Good morning, everyone. Welcome to today's live update. Today, I am joined, as always, by Dr. Spencer Gregg, Director of our Health Center. I want to start today by thanking all of our students who have been participating in our community saliva testing program. We will begin announcing next week that some residence halls and Greek housing will see temporary restrictions lifted thanks to their combined high participation and low positivity rates. So that's great news. Stand by and listen for that next week. I'm really proud and appreciative of those students who have stepped up to keep one another safe. Before we get into the data today, I want to talk a bit more about vaccines. Dr. Gregg, you are once again joining us from a vaccine hand-in-hand clinic here on campus, and we are working hand-in-hand, I should say, with the health department to host a vaccine event for those in our broader Knoxville community who are now eligible to receive an immunization. So Dr. Gregg, can you tell us about today's event a little bit?
Good morning, Chancellor. It's certainly a pleasure to be with you again today. And you are correct. Today, I'm joining you from the Student Union, where we're having our third COVID-19 vaccine clinic. Folks are so excited to finally have the opportunity to receive the vaccine, and we're so pleased to be able to assist in that regard. Today's clinic, like yesterday's, is a public-facing event for those age 70 and older and those in phase 1A1 and 1A2 of the state's vaccination plan. Phase 1A1 and 1A2 are primarily healthcare workers and healthcare-related fields, and includes those who may have regular contact with patients that are potentially infected or other workers who may have contact with potentially infectious material. Last week, we were able to provide the Moderna vaccine to around 560 individuals in these age or phase groups. Yesterday, we provided vaccine to just over 700, and today our goal is to again vaccinate up to 700 individuals with their first dose of the Moderna vaccine. We're really excited to have this opportunity and look forward to making the vaccine more readily available to both the campus community as well as the greater Knoxville community.
Dr. Gregg, I want to thank you. I'm so proud and really happy that we're engaged and involved like that to help the larger community. Here's another question, though, about the vaccine. As the vaccine becomes more widely available and eligibility expands, what are we going to do to get ready prepare for broader distribution, both among our campus community and the broader community?
Well, we've really been spending a lot of time working with the state and local health authorities to make the COVID vaccine accessibility more routine. As individuals in our campus community become eligible to receive the vaccine, we want to make it as easy as possible for them to get it. We'll announce these events as plans for them are finalized and as the vaccine availability permits. It's important for everyone to be familiar with their phase eligibility. You can determine your phase by going to the state's eligibility tool. We've placed links to this tool at the UT's COVID website and also at the Student Health Center website. Remember that vaccine will be dispensed only to those who are age or phase appropriate. So knowing your phase ahead of time is very important. For our campus community, we'll also continue to reach out to departments that may have phase eligible faculty, staff, and students in training to make them aware of these vaccination opportunities. The vaccine will be distributed by appointment only, so only those who are phase or age eligible and who've signed up for an appointment may receive the vaccine at one of our events. And again, we're going to make this information available as we're able to finalize those plans.
That's great. It's really exciting to see that happening. So now let's talk about the data. So let's go to the data. It's all available on the website. So as you look at this, we're going to talk about, as of this morning, we have 94 active positive COVID-19 cases, 94. 74 of those are students and 15 are employees. There were 8 new active cases reported yesterday. Now, as of now, we have 310 people in quarantine or self-isolation. Of those, 260 are students. So that's about the number of cases. Let's talk about testing. So last week, we collected 4,140 samples. 4,022 of them were from residential students. We tested them in pools of about 5 samples each. Out of the 857 pools, we identified 15 pools and 89 individuals were referred for diagnostic testing. Of those who were tested, we identified 14 positive individuals, all residential students. Now, our overall participation rate for residential students was 63%. This is down from 71% last week. So that's something we need to fix. So parents, students, you've been assigned a day of the week to participate in the testing, and it's a requirement. So let's get that number back up. Our positivity rate across all 4,696 samples was 0.34%. That's 0.34 of 1%. Now let's talk for a minute about clusters, because we also are required to report about clusters. We've identified 2 new clusters this week, both in Greek housing. In both cases, they've been identified as clusters simply because the living arrangements in sorority and fraternity houses lead to a lot of close contacts. I want to thank all of the students involved for cooperating with our contact tracers and for entering quarantine immediately. That is helpful. The first cluster is located at the Alpha Chi Omega house, and it involves 2 positive cases of the virus and 18 close contacts. Our community saliva testing program identified this exposure early, and all of the students acted quickly to take precautions, and we're grateful for that. The second cluster is at the Zeta Tau Alpha house, and it involves 1 positive case and 29 close contacts. Everyone there has been very cooperative with the contact tracing and about quarantining. We appreciate all that help. So let's just talk about the metrics summary for a minute. These are now the things we look at to help us assess where we are and what kind of things we need to do to stay ahead of this. So let's take a look. As a reminder, this table includes indicators we use to evaluate whether we need to tighten or ease our temporary restrictions. So here on campus, our daily average for new cases over the last 7 days has been 9.4. So on average, 9.4 new cases each day over the last week. We are also monitoring the cases in Knox County, which are 27 per 100,000. This is down just slightly from last week. Another indicator, both the hospital ICU capacity and adult bed capacity are at 10%. Both of those are down from last week. This is a number we want to continue to see. We want to see it increasing. Our capacity to respond to positive cases and care for quarantining and isolating students remains high. Our contact tracers are still responding to all cases within 24 hours. And our diagnostic testing at the Student Health Center has a 1.5 day turnaround, day and a half turnaround. Our 14-day positivity rate for community saliva testing is at 0.29%. That's 0.29 of 1%. We are using about 18% of our quarantine beds and about 2% of our isolation beds. That is really all we have for today. So I want to thank everybody for joining us. We talked about the vaccine clinic on campus. We talked about our testing, the pool testing. I want help from the students in getting that rate up. We talked about the specifics of the indicators we're looking at. We're all in this together. Let's keep working together in a positive way, and let's complete this semester in a strong way. So thank everybody for joining us. I hope everyone has a safe weekend. It is Big Orange Friday, so go Vols.